Okay, good job.
Right. Yeah.
Does that go with it? These are things that I just want to send out that original email that I.
What happened?
Charles.
Is it still plugged in? Because you pulled it off the wall.
Yeah, I can start with your page here.
Oh, it's behind your chair.
Yeah, I do have
Underneath the roller.
access.
I knew I saw you.
I know, I was taking that show. I forgot I just plugged it in.
They got you.
And I really.
Yeah, we know. Well.
Because that's what she's starting.
I know. I'm like, what is your dashboard?
Read the word offer or offer or was provided. How did oh my God. I'm sure I have last one. Well, yeah. But it's basically. I don't know if you noticed. That article was written like that.
Will, did you bring another cup?
And I read it.
You gotta get your own cup. And then hide it in there.
That's what I do, but it's still gone.
In that room?
You're a little light on that end of the table.
Have you lost the skills you had as a 10-year-old? Just squirrel stuff.
Just hide stuff, huh? Did you successfully scare everybody else off? I did shower this morning.
TMI.
I thought there was something different down there.
Oh, you want to start? Do you have notice if they're not going to be here?
Rick told me he might be a few minutes late.
Oh,
He's here
okay.
for March.
Okay.
March here, I saw.
I'm good when you're ready. It's up to you.
Yeah, let's get started. All right, I'm gonna call this meeting to order. Stand for the pledge, followed by a moment of silence. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Have a roll call.
Just a reminder for everybody to turn their mics on. Commissioner Robbins is absent. Commissioner Walter.
Here.
Commissioner Bunnick.
Here.
Commissioner Wessel.
Here.
Commissioner Campbell.
Here.
Commissioner Alguier.
Here.
Chairman Yoder.
Here.
Thank you. Next up, we have approval of the agenda, late additions or deletions. Anybody have any late additions or deletions? I'll take a motion.
I move to approve the agenda as presented.
Supported by Commissioner Wessel. Discussion? Not, all in favor of that motion, signify by saying aye.
Aye.
All opposed, say nay. 6-0. All right, next up, we are to communications, an update from our administrator.
Mr. Chair, because we have a number of presentations, I prepared a written update, which I try to do anyways, but listing seven items that you might not have been aware of. If there are any questions about this or anything at all that's not on this update, I'd be happy to address them.
Questions for our administrator? All right. Not. We'll move on to Office of the Medical Examiner, Dr. Hadsma. It's here.
Good morning.
Good morning.
Where shall I go here?
At the table there.
Very good. This is the only county that I get to sit down and present at. I'm usually standing at a podium. Good morning, everybody. I'm Dr. Patrick Hansma. I am your medical examiner. It's my first time being able to be here in the flesh to present, and so that's wonderful. I know it's a busy agenda, but fortunately, Leelanau County is quiet and peaceful. I'm just going to run you through the numbers from 2024. Each of you has in front of you a printed copy. The full annual report is also on our website, which has preliminary information on how the medical examiner's office runs, National Association of Medical Examiner accreditation factors that influence how our office operates, the state statute, things of that nature. So if you want to review that at your leisure, you can, but just in front of you in the printed packet is Leelanau County. And so right on that very first page, as you open it up, there's a summary of all the county cases reported to our office and across years 2017 to 24. And if you just run down that right column, that's all of last year's numbers. So 202 deaths in the county total, and 42 of them investigated by the medical examiner's office. 7 of them were brought down to Kalamazoo to the medical examiner's office for a postmortem exam, and only 1 of them required a complete autopsy. The others received an external examination, full body CT, full body X-ray. So we have a variety of different options for what we can do to accomplish ascertaining cause and manner of death. 12 cases referred to gift of life. Again, just working your way down that column. 1 of them successfully for tissue donations, and only 1 unclaimed investigation. This is becoming ever increasingly a burden on the medical examiner, our unclaimed bodies. I don't know exactly what's going on with that. It's a cultural thing or something, but increasingly people are not claiming their loved ones for disposition. And so it's occupying a tremendous amount of our office's time. In other counties, Leelanau fortunately was only 1. The next table below that is just cremation permits. 85% of deaths that we dealt with were ultimately the disposition was cremation. So that's increasingly a popular option, and our office reviews cremation permits. We review the death certificate and the permit just to make sure that nothing suspicious is slipping through before that body is cremated, and all possibility of potentially solving a homicide or whatever is lost forever. So that's why we're involved with that. On the next page, you see again, across the top, it goes 2017 to 24. And so just reading down that far right column, are the manner of deaths that occurred in 2024 in Leelanau. 36 of the 42 were natural, 3 accidents, 3 suicides, no homicides. That's awesome. So we love that. Every one of these deaths is a tragedy, but we like zeros, so we celebrate those. And then at the bottom of there, you will see deaths reported by age. And now we're looking across the bottom row instead of the right column. That's your 2024 numbers. And you'll notice they're all adults. So no pediatric fatalities in 2024 reported to the medical examiner. So that's great. We love that as well. From these numbers, it looks like Leelanau is a very safe place to have children. And then going to the next page. So obviously the pediatric deaths at 0 right up top. And this is the second year in a row, actually. 2023 was also zeros. Accidental deaths by mechanism. Reading down again, the right column, 2024, there were 3 accidental deaths. 1 was a drowning, 2 were falls. These were almost certainly, I don't know for sure, but almost certainly falls in the elderly. So little old lady sustains a ground level fall, fractures her hip, never recovers, as opposed to a fall from height, like off a building or a bridge or something. What is shocking to me there is no drug overdoses. Drug overdoses, when they're not suicidal, are by convention mannered as accidents. No drug overdoses in Leelanau County in 2024, which is just shocking to me. I mean, we're in an opioid epidemic. You're going to hear about opioid relief funds after my presentation from someone else in your county. No overdoses in Leelanau that resulted in fatality. I mean, that's congratulatory. It's amazing. So I'm excited about that. Then drug-related fatalities right below that, it's zeroed out all down 2024. So that's great. To the next page, suicides by age. 2024 is going across the bottom instead of down the right column. We're going across the bottom row, and it was kind of evenly distributed across adults. A little bit surprising that nobody was 65 plus. It's my general observation that suicides kind of skew towards elderly retired men, not uncommonly they're widowers. So it's just my casual observation. That's not science. So I'm a little surprised that it was a slightly younger demographic here, but nothing shocking when you're down into single digit numbers. You can't make anything out of that statistically. And suicide by mechanism, interestingly enough, reading down 2024 column on your far right, all three of them were hangings, which is a little bit surprising also. It's usually an even distribution between firearms and hangings in my personal experience. So no firearm fatalities at all, neither homicidal, suicidal, or accidental in Leelanau County in 2024. So that's excellent too. And that is the annual report, rapid fire. And I take any questions.
Any questions?
Thanks for the good news.
Yeah,
Yeah.
thank you. It's my pleasure to serve.
All right, thank you.
Wonderful.
Appreciate the update.
Yeah, absolutely. Thank you. Have a good day.
Thank you. We do something enjoyable.
All right, next up, we have the opioid settlement funds overview. I believe we got Amy here.
Good morning.
Morning.
Thank you all for having me. I'm Amy Delinke, the technical advisor on the opioid settlement funds with the Michigan Association of Counties. So today just wanted to provide a brief overview of the settlements themselves, some changes that are happening right now that we're in the midst of with new settlement sign-on and reporting changes, as well as offer our no-cost technical assistance support. So my job is to provide support to counties however they want, whether that's weekly, once, or administrative. We'll kind of walk through some of those other things that may come up that we offer services for. I work with 74 other counties in the state. So we can jump to the next slide. And I know you guys have some additional documents in your packet as well. So just an overview across the state of Michigan, we're anticipating $1.6 billion. The majority of funds are split 50-50 between state and local governments. So that's counties, cities, and townships. We do have two settlements that the county is able to sign on to right now. One, the Purdue-Sackler settlement, and then the second is the generic manufacturer settlement. So that includes 8 companies. So those are the Sackler and Purdue settlement ends, or the sign-on ends September 30th, and then October 8th for the generic manufacturers. We can go to the next slide. So this is a brief overview of what's anticipated dollar-wise in the county over a total of 18 years. These companies pay out at different rates. They do not have to pay the county every year. They can skip payments, they can front load payments. The dollar amounts are going to fluctuate, and the number of years each company is paying is different. So looking around 900,000, a little more with the generic manufacturer settlement, although that will be a very small dollar amount. And this will be over an 18-year period. You can go to the next one. So each settlement has a specific percentage of funds that have to be used for purposes of opioid remediation. So aligning with the legal definition of opioid remediation, which I will provide, as well as a document titled Exhibit E from the National Settlement Documents. Exhibit E is a 15-page document outlining the allowable uses for expenditures for settlement funds, but it's also legally defined as a non-exhaustive list. So there is some room there. We can go to the next one. Yeah.
But doesn't it say in there that only 70% has to be used for, for opioid remediation?
So 70% has to be used for future opioid remediation. So that means that you have the ability to reimburse for activities that were for purposes of opioid remediation, but had already taken place. So future opioid remediation just means activities that have not yet taken place, but you are required to spend more on opioid remediation as a whole. So typically we say about 85%, which would be the majority, but some all the way up to 95.5% or 94.5%.
I thought I read that it all has to go to,
So
it says that somewhere.
the way that the settlement agreements are written is that all of the money should be used for opioid remediation. But that doesn't always account for things like some indirect expenses for folks that are granting out their funds, doing a competitive bid process. Some of those indirect funds would not qualify. And so there is room for things like that. Attorney fees is kind of a separate bucket as well, up to 15%. So that's separate. But there are some things that we do see counties spending on that do not align with opioid remediation, but are really required to facilitate carrying out those services.
But it has to be related.
It all
It's not
should
direct.
be.
Should, you keep saying should.
Correct. So historically, up until the Purdue sign-on, the only person who could determine allowability was Corporation Counsel at each local unit of government. As of the Purdue sign-on, when you sign on to the Purdue settlement, you're also agreeing to a change state subdivision agreement, the legal document that ties the county to the state and those specific requirements. And so now there is the ability for the Attorney General's office, one, they're requiring mandated annual reporting. And two, they can now provide guidance. So they could say, we only allow 10% here. And then any of the funds that come in as interest on what you have in the bank, those are unrestricted funds. But again, the goal is for all of these funds to be used as much as possible to those most profoundly impacted by the opioid crisis. But there's definitely nuance, and I am not an attorney. But we do have, the Attorney General's office who can provide guidance on some of those specifics as well. But a lot of work with Corporation Counsel.
But you're not giving us permission to take $50,000 and put it on housing.
If that housing was related to substance use disorder and the opioid crisis, you may be able to do that, yes.
Okay, good. That
Yes.
answers it. Thank you.
Yeah, there's definitely a lot of nuance.
Amy, is there a limit for administration? How much can be put in towards administrative costs?
So the majority of administrative costs would actually be considered opioid remediation. So they do support planning, facilitation. It's not like federal grants or things that typically come in where there is that. But I have seen most commonly when funds are going out through a competitive bid process, a cap on indirect expenses at about 10%. Okay. So this is the legal definition of opioid remediation. And I really want to point to number 3 here because it allows you all to not just focus on the opioid crisis, but on polysubstance use as a whole. So people that are using more than one substance and co-occurring conditions. So individuals who have both a substance use disorder and a mental health diagnosis. So it really allows, as we see the drug overdose landscape changing over time, it allows you to be able to address that over the 18 years of the settlements.
So yeah, so if a person is, injured or dies or something from opioid, then this would be to help the family, overcome it for counseling or other things. I mean, that's the way I kind of read that.
It could be. Most often we do not see that taking place where it's a fund created to direct funds to individuals in the community. Typically, we're seeing services provided. So supporting housing providers that do recovery housing, supporting prevention work in the schools, supporting treatment or transportation to treatment, things like that, or recovery support services. So more of those community-based organizations and providers seeing funds, not to say that you cannot create a fund to support individuals in the community. That is an option for you as well. With the dollar amount, that would be the only challenge. All right, we can go to the next one. So Exhibit E, 15-page document, focuses on prevention, harm reduction, treatment, and recovery. The goal is to avoid anything that is punitive or coercive in nature, and to really focus on helping those most profoundly impacted by the crisis. We can go to the next one. So for the reporting requirements, for the national settlements, you do have to, as the county, report biannually for most settlements. CVS is annual. And those reports will come in to the folks that are a part of the payment portal. So I would imagine finance director, county administrator. And the report that goes to Brown Greer is around the specific dollar amount used for non-remediation purposes. So if you were to fix a road with some of those funds, that would be a dollar amount that you would report to Brown Greer, the National Settlement Administrator. The new requirement for reporting is starting in fiscal 26, an annual report to the Attorney General's office in Michigan. That report really is very simple, and it will be information that you already have based on spending. So dollars coming in, dollars going out, what specific programs or activities are funded, and which specific organizations or county departments received that funding. So very simple, something we can absolutely assist with as well. We can go to the next. So this is just a bit of a breakdown of what else is in that state subdivision agreement, which we already talked about. Next one. So at MAC, we do an annual voluntary survey to gauge a bit of what's going on around the state. We do have an opioid settlement resource center website, which has a dashboard, which we update with the data collected and then issue a formal report on an annual basis to really understand planning efforts that are taking place around the state and spending. This was all prior to the new change in state reporting. Next one. And the next one. So here's just a map of the counties that I'm currently engaged with in some capacity. Some of those folks, again, work with me one time and that's it. Other folks meet with me up to weekly and in a variety of ways. So we can go to the next one.
On this one, some are white and some are, I can't see the rest of it.
So the green counties are the ones that there's a higher level of engagement with. The gray counties are the ones that have asked a question or just for some information. And then, so there's engaged information request, and then the white counties are the ones that I've had no engagement with. And my position started November of 22 and will end September of 26.
So we changed colors.
You did. You guys are 75. Yes, I'm so excited. So these are just some of the supports we provide through MAC. We offer weekly office hours. I'll talk about our local government learning community, which is a closed meeting for local government officials, township, cities, and counties to talk about settlements. This Friday, we'll actually have the Attorney General's office there to be able to answer questions about the new reporting requirements and the settlement sign-on. So we offer presentations. Our website has an extensive list of templates and tools. So these could be resolutions, contracts, RFP, whatever you could possibly need. We've typically built a template for that. You all can take those in their original format, Word, Excel, PowerPoint, and use them, or we're able to work with you to customize any materials or create new materials for you. And then any of really these other services. So everything from administrative support all the way to meeting facilitation, strategic planning, whatever you could need. Next one. So this is just the dashboard. There's a little drop down where you can look at the county, see the estimated dollar amount, and then kind of click through some of those tabs. Just a good place to kind of check in with as we see settlements changing. Next. We do also have a resource library. I was unable to be concise. So it is very extensive. And if you need resources, please feel free to just reach out to me and I'll pull the resources that you all need or pull the specific information from those resources. Next. So most counties are working from a toolkit that we released in January of 23. So January 31st of 23, we released this document, and that was the first day that funds came into county governments from settlements. So the toolkit, you do have an executive summary in your packet as well, but the toolkit is a process document intended to help kind of walk through specific steps. So stakeholder engagement, making sure those local experts are at the table, then being able to look at what data is available and what data still needs to be gathered, determining capacity for the process moving forward, and then monitoring and accountability. So a toolkit to really just help in the process piece, and was able to get folks to then kind of figure out which pieces they wanted to use and which they didn't. Next. We can go to the next one. So this is just the local government learning community. I'm happy to send that to anyone interested following today's meeting as well. Next.
Is that online or how?
It is on our Opioid Settlement Resource Center page in the second blue bar, kind of in the middle of the page. So these are just some of the templates, tools, and guidance documents. A lot of the pieces that we create, whether it's transparency guidance or the RFP, we're working with Johns Hopkins and some of the national partners to customize our materials and adapt them for the national landscape as well. So we work really closely with the National Association of Counties as a part of their Opioid Solutions Leadership Network. But again, have created a lot of things here. But if you don't see something that you need, or we want to do something completely different, happy to support you all however I can. Next.
Could you go back to the, a couple slides where a guide for local spending?
Yeah.
You are suggesting 4 different areas, and the first one was stakeholder engagement. What are some counties doing to get stakeholder engagement?
Yeah, so the majority of counties that I've worked with have started by creating a local steering committee specific to opioid settlements. So not a decision-making body, but a group of experts to be able to provide recommendations to you all. And so through that process, they're typically engaging a multitude of sectors from prevention, treatment, harm reduction, recovery, local business, healthcare, medical examiner, all sorts of folks at the table. And then once that group is together, that group determines, do they want to conduct a full needs assessment? Is there enough data already available in the county to move forward? But really having those local experts to say, here's where we see gaps. So really working to identify gaps and priorities. Typically from that point, that steering committee will develop a request for proposal or a competitive bid process for the community. Then that would go out based on those priorities that have been identified, typically housing, transportation, those types of items. So anyone would be able to submit to that proposal process, but the proposals that address the county priorities would then receive higher scores potentially. But it allows then you all not to have to figure out what are those specific needs, what's the data to support all of this, but you're asking those providers and community-based organizations to provide you with that data and rationale for their requests. So that's the typical process I'm seeing in most of the counties I work
So
with.
that's just to clarify for me, that you're talking about experts and social service agencies and providers and doctors and.
Absolutely, yeah, and including people with lived experience with substance use.
And then it's an open process where they request proposals from throughout the community.
Yes.
Folks who can address those needs.
Yes, that is what most counties are doing. Depending on the dollar amount, though, some counties are unable to do that and may choose to do some internal departmental funding or have a different process for internal departmental funding and community-based organization funding.
And community here. That.
There's a lot
Because
of
they reach
community
out.
here.
Because they reach out to all the organizations doing that kind of
So just a few more tools and templates here. We can go to the next one. And this is just my contact information. I'm happy to answer any additional questions you have or continue this conversation about how I can best support your efforts in this space. Anything else I can answer for you today?
Is this a record for you?
Usually I spend the whole hour. So
Well, would there be a class on this at the NAT conference?
there will not be one at the MAC conference this session. At the end of the month, yeah, not this time. But we are happy to do a webinar or, host an online session, or I'm happy to come back up as well. Thank you.
I know spending is obviously Leelanau County is a priority, but we as a county lack services to actually treat opioid addiction that I know of. I don't know of any organization. We do have some in Traverse City. I happen to be at Safe Harbor and talk to them a little bit. And they do have a number of folks from Leelanau County who spend time with them. And so that's my question, is that it doesn't need to be, as long as we verify that these are county residents, they're being treated out of the county, they would qualify.
Yeah, you're not required to spend the dollars in county, but obviously most counties want to spend funds on their residents. And so however you do that would be possible.
And I believe that most of those agencies that are serving Safe Harbor, Community Mental Health, Munson, are all part of the Family Coordinating Council. And that was the purpose of that council when Engler proposed it, to coordinate the delivery of social and medical and support services without duplication. So I think we've got in our county a Family Coordinating Council that ought to be at the table.
We also have the Sud Board, who's somebody here is on the Sud Board, but having a program approved is challenging, specific, and they're very, very careful. So to use funds for programs like at the Sud Board, you have to meet very specific stringent criteria. Would this be different? It would be.
Yes. Yes, you're not required to do a competitive bid process. I will say that. I mean, if the county chose to spend its money today, that's absolutely possible. You don't have to do any community engagement. But then in terms of requirements for use of the funds, again, Corporation Council would be critical in that. But if the intention is to reach people profoundly impacted by the substance use crisis or the overdose crisis, even if that's maybe something that isn't just opioids, or meeting specific clinical criteria, that then there's still the possibility to spend with these funds, because they are settlements and not grant funds.
So what if someone is in recovery and they're seeing a therapist?
Yeah.
Could we have a fund to help them pay for that therapist?
Absolutely.
So we could just have a fund just for that.
Yes. Yes.
So what if they're in alcohol recovery?
So I think that's where it gets a little tricky, right? And so is anything inherently wrong with any form of recovery and supporting that? No. But how would the county then determine who would qualify, who would not qualify, who's making that kind of clinical? So it's more of an implementation question than allowability question of how will those decisions be made?
If the county wanted to, say, set up a process where we would have somebody facilitate us through a decision-making process to create, to decide what to do with these funds and how to do it. Is that something that you could recommend something for, or do yourself?
Yes, yeah, I can do that, or we can bring in some of our other no-cost technical assistance providers, potentially for needs assessment or other plans that may go into place, whether it's landscape analysis or needs assessment, to identify priorities and needs.
Just on the RFPs, because everyone I talked to at our meeting, they went through the RFP process, and I just left with the feeling that that was kind of a rural county, more of an option for rural counties, because we don't have treatment centers, we don't have hospitals, we don't have those places where that would be naturally that they're naturally lean towards those. So am I correct in that a lot of the rural counties go through that route?
Absolutely. I mean, we're seeing it in the metro counties as well. They just technically have more capacity, so they're able to do more. But I think there is a pretty heavy administrative burden on rolling out an RFP, doing reimbursement, or, distributing funds, reading quarterly or annual or monthly reports, financial and programmatic. So it's really about understanding capacity. But I do think that most rural communities that I've worked with have felt most comfortable saying, we don't really know all of the things that are out there because they're not in our county. And so we want folks to be able to apply as long as they're serving our residents.
One more, I think you mentioned it, and I think it was in here, but I don't see it. Over 10 years, what do you anticipate that Leelanau County will receive?
About 900,000, a little more than 900,000 with the Purdue, Sackler, and generic manufacturer.
And we keep all the interest.
Correct.
That is not burden. We use that for anything.
Correct.
All right, thank you.
Thank you.
Appreciate the update. All right, next is we have Housing Collaborative. We got Jamie here presenting, I believe. Good morning.
Good morning. Thank you for the opportunity to be here. For those of you who I have not met, my name is Jamie Jewell. Today I have a short presentation on behalf of the Housing Collaborative for Leelanau. I'm very pleased to be joined by many representatives of the organization that make up our collaborative. At the end of this presentation, we would welcome your questions and thoughts, and I may call on some of them to help me share their additional insight. Before I begin, I'd like to share with you a little bit about myself so you know the perspective that I bring to this work. I've had the privilege of living in Leelanau and working in Leelanau since 1991 after graduating from Grand Valley State University upon completion of a 2-year, 3-semester co-op program with the Homestead. For the next 26 years, I served in various management and officer positions with the resort. One of the challenges we consistently faced was recruiting an adequate number of employees and housing to support them, a challenge that only has become more pressing across the county. In 2017, I joined Shop Team Premier Realty as their marketing director and a sales associate. Alongside that work, I've served as the executive director of the Leelanau Peninsula Chamber of Commerce, and more recently, I've been providing administrative support for the Leelanau Peninsula Economic Foundation. Across each of these roles, one constant theme has emerged. Housing is critical to sustaining our communities, our businesses, and the overall vitality of Leelanau. That's why I became involved in the Housing Collaborative and why I'm here today to share more about who we are, what we've learned, and the steps we are taking to address housing in Leelanau. You can change the slide, please. Here's a quick roadmap of our time together today. I'll start with an overview of the collaborative, introduce our members, share our vision and mission, and then walk through what is guiding the development of the housing strategy. I'll highlight the main barriers we face, the action steps we've identified, and how we plan to turn strategy into action. Finally, I'll close with a request for the county representation on the collaborative. You can change the slide. The Housing Collaborative overview. The roots of this effort date back to 2017 when the Housing Action Committee was formed with the goal of supporting housing for families, professionals, and the workforce. Fast forward to 2023, and the Leelanau Housing Collaborative was created under the Leelanau Peninsula Economic Foundation and Housing North to bring organizations, businesses, and government partners who are working to address the housing needs under one umbrella. Housing North has stepped in as a key partner to engage the public and lend their expertise in the development of the Leelanau County housing strategy, incorporating best practices, legislative action, and resources from the 10-county region and the state of Michigan. In short, the collaborative is the next chapter in building housing solutions together. Next slide. The collaborative members, our strength comes from the diversity of our members. from nonprofits like Habitat for Humanity, Homestretch, and Home Sweet Home, to faith-based organizations such as Leelanau Christian Neighbors, to local government leaders and community-based groups. This collaborative represents a broad cross-section of voices and experience. Each member brings a unique lens, whether that's building homes, providing direct services, or shaping local policy. And it's that diversity that makes the collaborative stronger. Next slide. The vision and mission. Our vision is clear: to develop housing options in Leelanau that serve residents of all ages, incomes, and household types, while still protecting our natural resources and way of life. Our mission is to create practical pathways for housing solutions at every level of government. We know there's no single answer, but by coordinating initiatives across the county, townships, and villages, we can move from vision to reality. Next slide. What developed the housing strategy, or what guided our development of the housing strategy? This strategy wasn't created in isolation. It was guided by data and by voices from across our community. We drew on a 2023 regional housing needs assessment, multiple surveys of residents, businesses, and community members, plus focus groups that were held in Empire, Lake Leelanau, Leland, and Northport. You can change the slide. We also sought input from interviews and leaned on the expertise from state and local partners such as MISHDA, Networks Northwest, and the Housing Michigan Coalition. The strategy is grounded in both local experience and broader best practices. Next slide. The main barriers to housing. Not surprisingly, several barriers emerged. Local zoning and master plans often restrict the types of housing that can be built. Land costs are high, especially compared to what is permitted. Infrastructure such as sewer, water, and roads is lacking in many areas where land is available. There's also a shortage for skilled labor to build below market housing. Funding and tools and incentives remain limited. And finally, inconsistent regulations on short-term rentals reduce the availability of year-round housing. These are complex challenges, but they give us a clear starting point. Next slide. Comprehensive action steps. Our proposed action steps fall into 4 main categories. Number 1, expand housing financing tools to make projects financially feasible. Number 2, strengthen planning and policy, so zoning and ordinances align with today's housing needs. Number 3, improve infrastructure alignment, ensuring development happens where services can support it. Number 4, enhance communication and collaboration, because no one sector can solve this problem alone. Next slide. Turning strategy into action. This is where the rubber meets the road. Strategy alone doesn't change things, but implementation does. The collaborative is committed to working with local governments, nonprofits, developers, businesses, and the community at large to move together forward. Our approach is to align efforts, leverage resources, build momentum, and deliver meaningful housing solutions. Next slide. What's next? The collaborative plans to return with the full details of the housing strategy, including specific tools and opportunities for action. But we didn't want to wait until every detail was finalized. We wanted to begin building awareness and securing additional partnerships now. The time to act on housing in Leelanau is now, and this collaborative is ready to lead that effort. Next slide. Request for county representation. This brings me to our request today that the Board of Commissioners designate 1 commissioner and the county administrator to serve on our collaborative. Having the county represented at the table ensures alignment, coordination, and a stronger outcome. This effort requires all of us to work together. Next slide. In closing, I'd like to thank you for your time and for your commitment to the future of Leelanau. We look forward to working with you to ensure that housing across the spectrum is part of a vibrant, sustainable community. We'd be happy to take some of your questions, and as I mentioned earlier, I may invite some of our collaborative members here today to share their perspectives as well.
Questions? Mr. Weston?
For years and years, we've debated a county's role in housing. Some say there's no role, some say there's probably too much of a role. I'm trying to learn about chat, so I did a chat search on what are counties in Michigan doing to support affordable housing. And many of the things that you're talking about doing, there is a county role for. And I'm hoping that we can agree that, yes, there's a role for the county. My list from that, doing that, when Trudy Gallo was here, we built homes, we built a condo, duplex in Lake Leelanau. We got that not out of county dollars, but because of our relationship with Michigan. We have so much opportunity to leverage our county support for Michigan state and federal dollars and grant dollars. Convening is a role that we have. I know we do, and I like your request for county participation, because we certainly do have a role to convene the partner. The land bank in Brownfield, we all know, and the land bank in Brownfield in this county has made a difference already. And
Absolutely.
we can't lose that. The advocating, the leveraging, the convening. I hope that we can figure out how to do it right. And I, for one, would recommend that we do, in fact, accept their request and have our administrator work with the group. But that's a long way up to leading up to my question. What does the housing collaborative see as Jim Dyer's contribution to the collaborative and the county role in the collaborative?
I think much of it is communication and understanding what all of the other organizations and groups are doing and are working towards, and understanding what the Brownfield and other programs that you have available to you are doing as well. So much of it is teaming our efforts together so that we're all working towards the same goal. Anybody else?
I asked, the organization itself will be a committee of Leelanau Peninsula. I mean, I don't understand the official health.
It's,
Yeah.
well, which lends to its name, the collaborative, where all of these groups are already working towards housing solutions. But we're finding that many, some efforts maybe are duplicated and some are, people don't know what's going on. So it's there are all these silos working towards helping housing. So we determined getting together and understanding what our opportunities are at a state level, at a local level. And Housing North has been doing a great effort for all 10 counties. And we read every week in the newspapers what maybe Frankfurt is doing or Elk Rapids is doing and what they've accomplished. Much of that has been done by teams of people coming together and understanding what the need is and what the solutions are to get them done. So that's really what we're doing. Much of our meetings are spent sharing information like, oh, here's what our group's working on. Did you know this? You know, here's what we're working on. Did you know this? Or, oh, I know somebody who can help with that. So that it really lends itself to the name itself. It's a collaborative.
But So pardon me, but I just kind of get stuck in the structure, and I don't understand the structure of this organization. Are there public meetings? Are there, is it kind of more of a coffee gathering to share? Because we're government, you know, and
Right.
as much as we
We're
argue about want to be government, and do I see this as a non-governmental entity? Or is it a nonprofit? What are you?
Share, please.
Yeah.
This is just my water bottle. Sharon Oriole, Glen
I'm gonna
Arbor
get up to
County.
the table here and just.
Certainly.
Get you on the audio.
So Sharon Oriole, Glen Arbor. I'm the Leelanau County Housing North Board member by way of background and co-chair of the collaborative. And so the collaborative really is what Jamie is saying. It is a group of interested and committed people, organizations to housing in the county.
You take, anyways, I think you're just, I think you're a very loose-knit organization. There's nothing wrong with being a loose-knit organization. I mean, I see advantages to it as far as government has its lane, and there's just so far you can go down that lane before in development projects.
Right.
That things, that things can get bogged down. And you guys meet monthly or weekly or?
We meet as we're a self-directed group. And so we have been meeting monthly. We do have agendas. We do, as Jamie said, one of the primary beneficiaries has been exchanging of information. And then we have worked developing a strategy to improve housing, which we are looking forward to sharing with you. So that has been, if we've had a goal or a work product, that has been it. And then the next logical step is how do we collaboratively work, and I'm going to say collaborative with a big C, across the county to best leverage scarce resources to increase housing. So, yeah.
And it does, to me, I think this is kind of a policy creating thing. To me, it makes a lot of sense for the Leelanau County to be involved and have a commissioner on there. Mr. Dyer and we're both extremely right, but I like separation between county government and the groups and nonprofits, because we end up becoming partners in these organizations, and we're talking big amounts of money a lot of times. So I would prefer that our county administrator not be a member, but a county board member certainly, or well, probably one is better, but or two. Just because I like that separation between county government and developments, either through for-profit or nonprofit. I think that's important. So that's what.
Thank you.
Nothing, and I know you do a great job. It just, but it isn't, to me, it isn't our current administrator, Mr. Dyer. It's just any administrator, I would say that.
Well, and am I permitted to comment?
Oh, please.
Well, and as we have understood how the county works, Jamie mentioned in her presentation, two key entities within the county who can have significant impact on housing are, one is your brownfields. And so we're looking for ways to leverage what the county already has with no additional cost. Or for instance, the Planning Commission could help townships and villages by developing model ordinances that say, here's an ordinance you can consider for an example, for a pilot, a payment in lieu of taxes. So there are things the county can do that are beyond the scope of a single commissioner based on the collaborative's understanding. So that's the reason why we said it would enhance the creation of more housing if we had both a commissioner and the administrator, whomever that administrator is. So,
John,
I thank you for your work. This is an important need. It's countrywide, but here in Leelanau County, it's pretty extreme. So thank you. I don't agree that our administrator should be. Because he's a tremendous resource. So this is critically important, and I hope that Commissioner Russell will reconsider for this, because you've worked on housing and you're so active in it already.
Can I speak?
But
yeah,
I'm
I'll let the other commissioner speak and then we'll go around to Commissioner Walter.
I don't think I'm done.
No,
Yeah.
you got a few more words? Go for it.
Yeah, I got stuck there for a minute. I hope you're working with townships, and I assume you are, because zoning is such a critical limitation. So I hope you are working with townships.
we are, and we do have a township administrator, a township supervisor as part of the collaborative.
Yeah, the
That would be-
township planning commissions are critical.
Yes.
Commissioner Walter?
Okay, now we're expanding this conversation, but this needs to be addressed in as part of agenda in a future meeting. And all we're doing now is not to be negative, but we're beating a dead horse. So they gave their presentation. We need to have them back, discuss how we're going to address the issue as a board, because it's not on the agenda and we can't do it now anyway. So we're beating a dead horse, so let's get on with our business for the day. I hate to be negative that way, but we have an agenda and we have to get work done.
Thank you, you're good at that.
Commissioner Bunning?
Yeah, I just wondered if you had minutes from the meetings, the collaborative meetings.
We sure, yes.
You know, and I'd like to see some of those. I'm sorry to see that the Conservancy is not involved. We know that land cost is tremendous, and I'd like to see them involved, because even right now, they're taking over Sugarloaf, which would be a great place for development, because they have the sewage, they have the things there. So, I mean, it would be nice to have them in part of this collaborative, because of land cost. I'm also disappointed that our planning commission is not involved here. I'm surprised they're not here. They have you've stated about the housing action committee, and it doesn't seem to be here either. So, and it doesn't seem to be part of this collaborative. So really, I believe this should come from our housing action committee, which rather than some outside force here or collaborative, you know. So I just wondered, what does our planning commission or our housing action committee say about this? And it'd be nice to have a report on the $60,000 that was given, you know, for housing over the last 3 years. So you know, it'd be nice to see a report on that. 60,000 that was paid out. So maybe that's what brought this collaborative together, but I don't know what happened with that money.
May I make one quick, you will, I believe in November, you will get a full report, Commissioner, on that amount. That was not given to the collaborative. And then to your other questions,
I'm Lois Bailey. I chaired the Housing Action Committee. At the last time we had a meeting, we had difficulties accomplishing a quorum. But when you look at the items in the 2017 commissioners meeting that we were to accomplish, we are at that last item on that to create a plan and involve a broader section of interested parties in the community, and that's what we're doing. And we're accomplishing it. And it's interesting and gratifying to find that there's so much activity in different areas, and we can trade information and try to benefit each other going forward.
and you are a member of the planning commission.
I am on the planning commission.
Right,
yes.
so a member of the planning commission is part of the collaborative.
Mhm.
Yes, I see that, but I believe that should be presented, this information should be presented by them, not by collaborative. I mean, this is a county issue then, and that's what you're talking to the county to be involved in it. And so then we already are, it seems like to me. But it would be nice to have those minutes in November before we make decisions about this.
Commissioner Russell?
Several years ago, Tony Lindsay, who works for Mishka, came to the Housing Action Committee and said, counties can't do it alone. But the community can't do it without the county. Every township, every village, every local government must come to the county for review of their zoning rules and a review of their master plans. Our county administrator has always been a convener of the supervisor group. Our planning office has always been a part of this. I wish we'd look at possibilities and not roadblocks. We've got to solve this problem. We've been asked to be a part of a group that's trying to do good work. There's housing starts because of Habitat for Humanity and Housing North and Home Stretch and formerly of Reach and all over this county. And it's because of people working together, with the county being a big part of that support. But why can't we acknowledge that we have a role? And why do we have to keep fighting that role? They're not asking us to spend a bunch of money. The Elmwood supervisor told you, I think, how appreciative he was when our administrator convened a group of the supervisors and they had a discussion about zoning and housing, and it was appreciated. The administrator has worked with the village of Northport, Leelanau Township. We have 3 different parties to the collaborative out there trying to build houses in Northport. We got to get on board. Instead of blocking it, we got to support it. And I want our administrator to do it, and it is on our agenda as a presentation. And now, whenever we have presentations, we can ask questions and we can state opinions. So I don't buy it.
All right, so I did make a note that we'll add it to our next month's agenda based on the request that you requested, where we'll have more discussion on it. But did any other commissioners have any questions before we, any other questions of the collaborative before we move on? All right.
Thank you for what you're doing.
Thank you.
Thank you for the
Thank you.
opportunity.
For the opportunity.
All right, next up, we are up to our first. Oh,
I'll be back in a second.
all right, we can take a quick. Let's take a quick 5-minute break. We'll be back.
Say boring, maybe we'll be back.
good too. How you doing?
My name's so I. I can find anybody for it, but.
Gene Kelly has
Like I said, I don't wanna fight it for it, but.
I'm ready.
Mark, don't let Mark go. Don't let Mark go.
Blame this all on me.
All right. We're gonna get started again. Went way past our 5 minutes, so let's try to crowd everybody in here. Next up, we are up to public comment. Anybody has 3 minutes? Is there anything that's agenda specific? Do we have any members that, or any public that wish to give public comment right now? I need to know who's speaking.
All of us. I'm Darlene Dorlack. I live in Centerville Township. I'm speaking to agenda item number 1 about the funding of early childhood millage. And I'm speaking on that agenda item because the voters of Leelanau have voted to approve the early childhood millage because they understood the benefits of early childhood education and the outcomes of future success in school. Parenting community is providing this very important early childhood education to more than half of our county children, and they need to count on full funding to continue their mission. I'm asking you to continue fully funding parenting communities and support our preschool children. Thank you.
I'm Deb Kuhn. I also live in Centerville Township, and I am previously a speech language pathologist before I retired, and I worked on the floor with families in special ed. And what I'm here to tell you is it was a program that required having delays and meeting criteria in order for me to help those children. Parenting communities, on the other hand, is a program that is available to anyone, and the benefits are very clear, that helping families raise their children, meet other families, do collaborative work together. Collaborative might not be a good word today. Group work together has benefited our county, and I see it. I saw it. I spoke with parents who considered parenting communities a lifeline. So I went to a township board meeting, and Mr. Campbell presented, and I was happy to hear he is supportive of the millage and spoke of childcare as part of it. I'd love to see it expand that way, as long as we continue to fund parenting communities. Thank you.
My name is Kim Bose, and I'm also a Centerville Township citizen. And I attended the Parenting Communities event in July. It was well attended. There were parents and children in many booths that take care of children. There were booths on books. There were booths on, there was one that was yoga or for children, and that was fun to watch too. And many of the parents said they were very thankful that the millage passed. And so thanks to all of you for being supportive of parenting communities also in the millage. Thank you.
I would just like to further say that I'm a former special education teacher, and I feel like parenting communities is trying to give the kids that need it the support early so they don't end up in special education.
All right, thank you.
Thank you. Thank you.
Public comment?
Good morning. I'm Sue Miller from Leland Township. And I am also speaking to the issue of the early childhood levy that you'll be voting on later today. I am piggybacking onto the comments that were just made about the importance of the current programming that has been in place since the millage was passed back in about 6 years ago. And I do want to say that I've been really encouraged by the discussion at your board meetings about the possibility of additional services and programs for parents and their young children. I think that kind of discussion is really so refreshing and new to some extent for this board. So thank you for doing that. What I would like to suggest is that any new programming be considered against the backdrop of the Parenting Communities program, which has been in place, is successful, is growing. So we don't want to take away from a successful program. If we're talking about childcare, dental care, great programs, great concepts, I think we just need a really deliberative process of planning for additional programming. And I think you have a lot of advocates in this community who would appreciate a slow and thoughtful process of adding any additional programming to this millage funding, or perhaps looking at other sources of funding for these programs. So again, thank you for your interest in this area. It's really important. We know we need to keep young families here to keep our community thriving. So I appreciate your interest in this topic.
Thank you.
Thank you. Any public comment? Yes.
I'm gonna stand if it's okay, more comfortable that way. Hi, I'm Justine Alafka. I'm here because of Steve Stanton's unfortunate passing. There is a gap in our Veterans Affairs Committee, and I had put in a application to possibly fill that role. I'm a veteran myself. I come from multi-generational military family. My grandfather was in World War II. My dad was Vietnam era, and my son is currently serving. So a little bit of everything military touches my life. And I'm currently highly involved with Mid-Michigan Honor Flight as well. So I get the opportunity to talk to a lot of veterans about what they want and need. And I'd like the opportunity to help my community. And I just wanted to put a face to my name. So do you guys have any questions for me?
And address public comment or back and forth, so.
Perfect, thank you.
Thank you.
Any other public comment?
Good morning, Tim McCauley from Elmwood Township. "45 years ago, when I started my career as a public servant, term not used very often these days, there was a major push within government to curtail nepotism, which, as you all know, is the hiring of relatives by those in power and authority. Nepotism is akin to the good old boy system used today. If I may share a story with you, years ago, there was a lawsuit involving a grossly wrongful death of an infant in a hospital. I had a personal grade school friend who was an attorney, so I asked him about the case. His reply, he could not talk about this case because he was an attorney representing the hospital. He did, however, share with me how the legal system works. It's not what you know about the law, but who you know, and what fraternity or sorority that you might belong to. Let that sink in for a minute. In other words, it's not about who you know, or it is about who you know, which is a social status, not about the law. And that's how decisions are being made. All one has to do is look at the local cases, recent federal case, local cases or federal cases to understand what is happening. Have we become a lawless society? Or are we discussing conflicts of interest? Or is this just the good old boy system at work?
Any other public comment?
Hi, Dana Getzinger, Elmwood Township. When the medical doctor was here, one of the things that he didn't mention, which I had just learned about, is that Michigan farmers have a very high rate of suicide. And so I thought it would be something that just to consider when you're thinking of that money. You might want to check with some of our farmers because their suicide rate is double the national average. Thank you.
Any other public comment? All right, thank you everybody for coming. Next up, we have commissioner comments. Commissioner Rollins?
I was going to save it till last, but since there's an audience here, I think they need to hear it. A few weeks ago, or let me back up a little bit. In one of our closed sessions, we spoke how we should probably give recognition to the people that deserve it, you know, employees and what have you. So I started that last month, and I'm going to do it again this month. I had the opportunity about 3 weeks ago. It's not walking the best, not that I'm walking better now, but the sheriff's department, sometimes we always wonder what the future is because we're older and we always talk about the younger employees. But I was really impressed. I needed their assistance in Empire. It was with a mental person, and Deputy Wigton showed up, who's a veteran, but 2 of our new people showed up. Deputy Fleece and help me out with the last name, maybe you know Jen, Amber?
Sterling,
Who-
is it Deputy Sterling?
Sure, yes, yeah, she was the other one, but I was really impressed with, you take my experience and you take Wigton's experience, and this guy was not going to deal with us, but then we had a guy that was on his last day of FTO, and I was really impressed how he just de-escalated the problem, and we accomplished it. And I walked away that I can say with those 3 deputies, our future with our sheriff department is in good hands.
Other commissioner comments?
I just gotta straighten something out here between Jim and I. I think I said we were both, and I didn't realize I had said we were both far right. And what I meant to say is we both feel that we're correct on whatever that issue was. Did you guys catch that?
Yeah.
Yeah. I didn't realize it. Anyways, not what I meant to say.
Any other commissioner comments? All right. If not, we'll move on to our action items. Number 1, equalization. We've got Andrew here.
Morning.
Good morning.
So today I'm here presenting the winter L4029 tax rate request form. So I was before you in May to present the summer L4029. So I was telling Commissioner Wessel, I'm like a bad penny. I just keep showing up. So as you know, in the state of Michigan, taxes are levied in both the summer and the winter. Some taxing authorities levy in just the summer, others in just the winter, and some like Leelanau County in both seasons. So for the county as a taxing authority, the millage levied in the summer generates the revenue to support county operations, and the county levied 3.2520 mills for operations, and the taxpayers were billed for that on July 1st. So the millages levied in the winter generate the revenue to support the road commission, senior services, and the early childhood program. So the L49 presented to you today is the document that authorizes the levying of millages to support those organizations. And the tax bills with those millages on them will go out on December 1st. The 4029 also functions as a worksheet to identify the maximum allowable millage rates, taking into account the Headley Amendment. So the maximum allowable millages that are listed, they're listed in column 9, are 0.4915 for the road commission, 0.3145 for senior services, and 0.2486 for the early childhood program. Now, the Board of Commissioners may levy less than the maximum allowable millage rate, but cannot levy a rate exceeding the maximum without a vote of the people. And lastly, the 4029 needs to be signed by the chairperson of the Board of Commissioners and the county clerk, and then just needs to be returned to my office by September 30th so that we can do all the preparatory work for the tax bills to go out.
Yeah, I would like to hear from the finance director what the fund balances for senior services and the early childhood, if I may.
Good morning. We'll start with early childhood. The projected fund balance for early childhood, once their fiscal year ends on September 30th, will be approximately $650,000. You have a proposed budget for their next fiscal year. It is $935,825 that you're considering in your budget discussions.
Senior services.
And senior services, your current fund balance is roughly around the same amount. That's after we factor in the last months of 2025. If they spend their approved budget, your projected fund balance will be around 650,000 there as well.
And that will get them to the next election.
And that's the question that is important to ask, because it is the running money. This money won't come in until January, February, March. And so, and then settlement in May is normally typical. So you do need to have that fund balance to move forward. Mhm.
These fund balances were as of January 1st or as of right now?
Well, what I do is I take the 1231 and I add the projected revenue less the projected expenses for the remaining balance for 25. So that when you levy going forward, if you want to maintain that, you would levy the projected amounts that I think Andrew has given you. And the proposed budget for senior services for 2025 that is in front of you for budget deliberation is 1.4 million. So if you want to maintain your fund balance for cash flow, then you would levy the maximum amount that Andrew has on his L4029 for senior services. And you might deplete your fund balance ever so slightly if every penny is spent.
Do we know that because I believe last year it was 0.2 for early childhood. And I think it was it 0.3 for senior services, or was it the full amount?
For seniors, it was 0.32, and that was the full amount.
So I would make the motion that we do the full amount for road, senior services, and continue the 0.2 for early childhood.
I second that.
Board discussion. All right, all in favor of that motion, say aye.
Aye.
All opposed, say nay. Carried 7-0.
Can I ask just one more question? The 650, I wanted to interpret correctly what you said. The 650 is on January 1st, but the bulk of the money for these two services in particular are coming in the next month to 6 weeks. No,
No, when this goes on the tax roll, the collection starts December 1st. And typically you will get early payers of their taxes and that will come in January, but they're all due February 15th in some townships, February 28th in others. And then they become delinquent and then the treasurer settles from the county in May.
I used to know what their fund balance, but I can't remember now as of January 1st, but it still is very sizable. I believe.
Approximately 650,000 in both the childhood and in senior services.
January 1st. Okay, so I think I'm correct in saying that there's $650,000 on January 1st, and the bulk of the money for their property taxes are coming in the next 6 weeks. No, I'm not.
If you think about the fact that if you go into January, February, March with only $650,000 in your cash balance, I'm projecting December 31st of 25. If the budget for senior services is going to be approved at 1.4 million, divide that by 4, your first quarter will eat up that fund balance pretty quick.
That's also when all the revenue is coming in, right?
We hope, yeah.
Well, it does.
Yeah.
I mean,
But it doesn't come in right away.
No, I understand that. I'm just saying that we get used to to the fall balance because so many taxes are paid in the fall. And in this particular case, from the time that we get our audit or we get our fund balance from January 1st, that money does not have to last 9 months like it does for many other services.
All right. Excellent, Board. Any other questions for Andrew or Kathy? We're good? All right, thank you.
See you soon, Andrew.
All right, take care.
Thank you both.
All right, item number 2, we have facilities. 2A, approval to issue RFP for replacement of dimmable lighting system. Something you're taking on, Jim?
Actually, this was presented by facilities.
I don't see that here.
No, it's a recommendation regarding again, the dimmable light system in the jail. There's a proposed motion and to essentially pursue an RFP, and Pat's included the potential RFPs that are potential contractors to distribute the RFPs and some potential possible grant money that we can pursue. But all we're really asking in this context is to allow us to submit the RFP for the work to be performed.
Mr. Walter?
So recommendation to Leelanau County Commissioners to authorize the issuance of a request for proposal to solicit competitive bids for the replacement of dimmable lighting systems at the Leelanau County Corrections Facilities connecting quarter with 2x4 drop-in LED panels as described. Direct staff to explore the listed applicable grants in programs for funding support prior to contract award.
Support.
Support, discussion?
It's budgeted. I don't know that answer.
It's not, because we don't even know what the cost is going to be at this point. And it may not be pursued necessarily in this budget year because of the timing.
Could get bids included next year, I guess.
And then included in next year's, yes. Again, it's intended to get competitive bidding to find out what the cost might actually be.
Which I believe is now a good time to get an RFP together because we're on a budget anyway, so.
Exactly.
Any other discussion? Not, all in favor of that motion, say aye.
Aye.
All opposed, say nay. Carried 7-0. All right, next up, we have the humidification system for LEC.
That one is, we're actually are proposing a specific acceptance of a specific quotation. I included or described give you a little preview of this in my last time I provided an update to you. It's a $16,420, $450.28 expense. This is actually the system that conditions the water to be, that flows through the steam humidification system in the jail. We're asking you to accept the quote from McCardle Culligan. This is a quote that was actually received back in September of 2024. And they've indicated they will honor that quote through the end of October 2025. That's why we're pursuing it at this time. It's, to be honest, an issue that fell through the cracks in the transition between new facilities directors and new administrators. Technically, it would be a waiver of your board policy regarding bid requirements, but essentially it's Culligan replacing a system that they installed some time ago that is now in need of repair. Our bid system or bid, your budget rules do not differentiate between necessary repairs and capital projects. Perhaps it should, but it would require a waiver of your bid requirements.
Russell?
I move to waive the bid requirement and approve the quote from McCardle Culligan dated 9/5/24, valid through October 2025 for the replacement of the humidification system in the correction facility.
Second.
Board discussion, Commissioner Bunny?
Yeah, I would just ask that, we say where the funds come from when we go to the next, at our next meeting.
That's reasonable.
Any other discussion? Not, all in favor of that motion, say aye.
Aye.
All opposed, say nay. Carried 7-0. All right, next up, we are to finance. This one's got MIDC grant acceptance.
Thank you. The MIDC grant is typically on the September agenda each year. We did get an update from Paul Jarbo's office regarding the compliance plan and cost analysis approval, that it will not happen until September 12th, and that we would move this forward, and it may be moved forward to October even. Administrator and I received an email yesterday from Paul Jarbo's office and saying that we are correct that Leelanau County, that they're still working through the review process on several systems. And at this point, because they have no state budget, they cannot issue contracts. There's an action item on the September agenda for the commission to approve an authorization to continue spending under the 25 fiscal year plan and cost analysis. We have no reason to believe they will not approve it. They have done so in the past, and it serves to support systems. If approved, everything will remain status quo until the system has approved the fiscal year 26 plan and fully executed contracts. I think it will be a timing thing, and we may have to move it forward. You will continue to pay at the 25 rates for indigent defense attorneys, et cetera. And once the contract is in place, you can pay private investigators and attorneys the difference retroactively. Systems will operate off their local share and unexpended funds until they receive the first disbursement of grant funding. And this is from MIDC. So I would say we'll just move it forward.
Got a motion for that?
Move this forward to next week.
All right, support, discussion. Commissioner Rounds?
Question for you, Kathy. I know when this started, 4 years ago, we were like at 45,000, so we really haven't gone up much, but do we use all this money? I mean, is it used up, or how does that work? Do they roll over?
We are to put in our share first, and we have to use our money first, and then the state funds us money so that we can operate and pay these indigent defense attorneys. And if there is a surplus, it's very small. I think on the settlement for the last fiscal, it was $17,000. I mean, it runs pretty tight. Yeah.
But what you read right there, it states that they have to wait for their payment. Do we make them wait? You know, the way I understood that, it said that you'll pay it later.
It's perhaps, Jim, did you read that email from Jarbo's office? I did, but I don't recall that issue was addressed. Bottom line is, there's no state budget, there's no money, there's no pay. We're not required to pay them unless we're funded by the state.
Are they aware of that? I mean, they might not get
Well,
paid. That's the way it read. I thought.
MIDC Commission Melissa says systems will operate off their local share in unexpended funds until they receive the first disbursement of grant funding. We always put in our money first, and that's $50-some thousand. That won't last too long.
Right. So then they'll have to just wait till the state
Yeah,
comes through.
because-
We're not responsible for it.
And I would have no money in that fund to pay. And I think counties we could conceivably take the issue. We're not guaranteed reimbursement. We're not going to be paying anything for our own portion of the contribution.
This doesn't seem right.
It doesn't seem right. The state's not adopting a budget either.
Any other discussion? All right, not all in favor of that motion, say aye.
Aye.
All opposed, say nay. Carried 7-0. All right,
And I would say the same with the managed council contract with Jarbo and Field to move it forward. We would like to have the MIDC grant in place before we contract with Jarbo to be our managed council.
motion, Mr. Money.
Yeah, I would move that. We move the contract with Jarbo and Field forward to next week.
Order discussion.
I'd like to ask Kathy a question. Is that up to $60,000 depending on the number of clients, or is it a 60,000 no matter what?
It's the managed council contract no matter what.
The last time Paul was here, it looked like he wasn't seeing many clients.
I can get the figures for you. Katie has that information as to how many clients they've represented in the last year, or run through that system that Paul manages, so that you can see the number of cases and the number of attorneys they're managing.
I would like to do that because I believe that we're paying a pretty good dollar for that.
Any other discussion? Not all in favor of the motion, say aye.
Aye.
All opposed, say nay. Carried 7-0. Next up, we got some housekeeping contract extension.
Yes. We're talking about your use of Leelanau County Family Coordinating Council as your manager of opioid settlement funds. And in your EDS, I gave you some history. Jim and I have gone over the origin of this relationship with Leelanau County Family Coordinating Council. And they were budgeted in 24, and this document that's attached to your EDS was crafted. And then in 25 budget process, the board determined that they would like to continue the services of LCFCC with regard to management of settlement funds up to $64,000, and it was appropriated. And Jim and I have looked at this contract a bit, and the one area term and expiration, the parties may extend this agreement for additional terms as outlined in an amendment to this agreement. So I think it could be discussed that it continues or it needs to be amended. I think it's probably best to put an amendment with this for 25. And Cole Stoker has been asked to draft that so that we can dot that I and cross that T, that we have an amendment to this document. And then you're going to consider their request for 26 in your discussions, along with all the information that Amy discussed this morning. perhaps look at other or additional uses of your opioid settlement funds.
All right. Russell?
I move to recommend that the Leelanau County Board of Commissioners move the amendment to the terms of the county use of opioid settlement funds funding and management agreement between Leelanau County and the Family Coordinating Council for budget year 2025 to the regular meeting on September 16, 2025.
Second.
Order discussion?
I wonder about, I mean, I know this is already in the budget, but I would appreciate, and I think we should include some reporting along with this contract. This is the, I guess I have some confusion. So let me start with, this is the 2024 budget or contract we have here.
That is when it was originally written, yes.
And the one we're going to consider is being rewritten by Cole Stoker.
Well, what should have happened is the contract in the 2024 contract should have been extended at the time you appropriated $2025. It just didn't happen for whatever reason. So we would revise the contract to continue it until at least through 2025 and perhaps through 2026 as well, if you approve their funding request in the upcoming budget. Yes, this should have been done back at the same time that the appropriation occurred, but it just didn't occur.
I guess I'm dealing with hypotheticals because I don't know what will be in the next one, but I'm assuming there will be some type of a budget provided in the contract before us next week over how monies would be spent. The contract does contain a scope of work with a budget, and it's essentially a continuation of those same services for an additional year at the same cost. I would like to have a comparison for 2024 of what was spent compared to what was budgeted. And I'm not trying to pick on this organization, but I do think it's important that we spend these monies, as wisely as possible. We just heard from the expert on the expenditure of these funds that the cap on indirect costs is typically 10%. For instance, here we have one of the most expensive pieces, coalition coordination. I have no idea what that is, but it's $12,000 out of $64,000, which is about double the 10% thought. I know you're going to say that they spend their money wisely and all that, but I just think that, I'm sorry, I didn't mean to dismiss about that. But I think it's our job to look beyond just what's in front of us and ask questions in more detail about how these funds are being expended. And honestly, I'm not sure. It was a previous county board, but honestly, I'm not sure I would have approved a budget that has $12,000 for coalition coordination. And if someone can explain to me exactly what Leelanau County, what this group is, as far as are they under the auspices of a court? Are they under, I tried to look online, honestly. I did not find a website. I tried to do research on the organization itself, and I know it's been around a long time. But I don't know if I don't think they're a nonprofit, didn't find them there. And I don't know the name of it. Yeah, you're a member, right?
I'm not a member, but I used to be the coordinator.
Okay.
And I was a coordinator for 4 years.
Okay.
We were not a nonprofit, but we were a part of the Department Department of Health and Human Services. They were our agent. And we also were payroll was processed through Goodwill and Northern Lakes Community Mental Health. Part of my job as a coordinator for that council was on a monthly basis. We had to get all the social services providers in the region, not just the county, but in the region together in a room and see who is serving what and what are the unmet needs. The coordinating council was put into place because Governor Engler said there's too much duplication of services. So I wanted every county a coordinating council of some sort to make sure that we're not wasting dollars. For that $12,000 that we're paying the family coordinating council, that pays the cost for those monthly meetings. It pays for Sharon's services. It pays for weekly laundry events at the laundromat in Sutton's Bay, where clients from across the county can come in there. Social workers are there, nurses are there, healthcare advocates are there, mental health specialists are there. While they're doing laundry, they serve those clients. That's what we get for the $12,000.
So who do we make the check out to?
Whoever their agent is now, when I was there, was DHS.
The fiduciary
know who
is
it
the
is now.
United Way now.
United Way.
So we make it out to the,
Yes.
and United Way is a nonprofit, we make it out to a nonprofit.
It's really a good organization.
Not denying that, I just, I really did look and try to figure out who these folks were as far as their structure, and I couldn't find absolutely nothing.
You can't find much of a more conservative Republican than Governor Engler when he tried to save money by establishing it.
It must be all right then.
All right, any other discussion? All right, not, all in favor of that motion, say aye. Aye. Opposed, say nay. That's 7-0.
Thank you.
Okay. Next up, we are up to administration. First one, D&W Mechanical Service Agreement.
Yes, this is an agreement with essentially for D&W to provide the hours that Gary O'Connor serves us on a regular basis, typically Wednesday, Thursday, Friday, and then part of Saturday, to essentially keep this building alive, as he would put it. It's a 3-year contract in the amount of $459,264 roughly for those services that he provides us. And it also sets out some terms for additional services that might be necessary above and beyond the regular amounts. It's essentially a continuation of the existing arrangement. We're asking you to consider that moving forward through December 31st of 2028.
It is recommended that the Board of Commissioners approve the 3-year service agreement with D&W Mechanical for facilities maintenance services provided by Gary O'Connor, effective January 1, 2026 through December 31st, 2028, at the total contracted amount of $459,264, and waive bid requirements due to the sole source nature of the dedicated technician arrangement.
Support. Support, discussion, Mike?
Yeah, I mean, now that we have a facilities director, I would think that this could be reduced, that he could take on some of the responsibilities that Gary does. You know, changing bulbs, things like that, that Gary does that are, they say are for electrical. But, I think there's things that he could do that are in his contract that we could really look at it seriously to reduce it. How much we get from outside work that's contracted as opposed to our maintenance guys doing it themselves. You know, rather than just renewing it completely. We didn't have a facility director before. Now we do. So I do think that we should really look at it a little more thoroughly.
Any discussion?
I really do appreciate what Gary does. And I don't think there's anyone who can replace him, honestly, on our staff, just as far as licensing. We just don't have anyone who can replace him. My question goes to the contract itself. Was I reading this correctly, that this really moves more to a salary contract, as in we're gonna pay 24 hours a week, when during the time period mentioned, he was only working 10 hours a week? Am I incorrect in that interpretation?
I know he works more than 10 hours a week. He's here basically 3.5 days. I'm not sure what portion of the contract or the presentation that.
If you look at what Patrick wrote, he did, I don't know from memory, although I wrote some of it down. He did an example of, I think, a 6-week period, and he said that Gary averaged 10.7 hours per week. I didn't know if he was paid 10.7 hours per week, or that was very confusing to me. So I just don't want to go in a position where we're enlarging those hours when, as opposed to just approving a new contract. Forward. Oh, I'd be glad to vote to move it forward, and maybe we can get that answer. And the other answer I would ask is, he talks about overtime hours, and I wanted to make sure that what overtime hours wasn't just beyond the 24 hours that we're contracting, that they're beyond the 40 hours, which is typically what overtime pays.
Kathy Stucker.
Oh. So, that, yep.
Please.
Gary is employed by D&W, and so D&W provides him to us at the number of hours per week in the contract, I believe. And so he's not an employee of the county. I'm not sure of the reference of 10 hours or whatever, but I do know he's on site, on campus, 3 days a week.
As well as a portion of the day on Saturday.
Yes.
Moved out.
Yeah, I don't recall 10.7.
It's on page 1 in here. It's an analysis of completed work hours by Gary O'Connor. It states your total completed hours 74.92, average hours per week 10.7, lower than the proposed 24-hour/week contract, suggesting part-time or as needed work for 20.5. So it's just an analysis, I believe, that put together.
Okay.
Looks like.
Of the, and yeah, that's the time span from June through August, June 12th through August 21st.
It didn't help his case. That to me is confusing.
Yeah.
It says he averaged 10.7 hours per week, which I could equate with the new contract. I agree, he's here all the time. I mean, yeah, probably more than
Well,
one.
we'll certainly get you an answer to that by next week, but I'm not sure why that analysis was included in the write-up.
All right, Commissioner Robbins.
I'm gonna keep it short because I know this, this topic is the contract, but sometimes you get Alan said a mouthful. He is great. He's the MacGyver of this building, and we're talking about today, but we never talk about down the road. He's not gonna be around forever. What are we gonna do? And we gotta start a budget or start long-term. What are we gonna do?
I've been
He's not
talking to
here.
him about that. This at least secures us through December 31st, 2020.
Yeah, I guess, I mean, I'm not trying to say to eliminate him. I think Gary does a great job and I like him. But I'm talking something like cleaning the screens. That could be done by our maintenance or, our facilities director, adjusting a flush valve on a toilet. I mean, I can do that. I mean, so I don't think that we have to hire somebody at $100 an hour when we have these people here, who can do those things. So, I mean, I would just say that we need to reassess what he does, still keep him on, but maybe it doesn't need to be 24 hours a week. That's all I'm saying. And that some of these things we could make it as part of making the facility director's, job, or his maintenance man, whoever.
All right, so from what I'm gathering here, everybody seems in favor of it, but if we can get some answers for next week at a regular meeting, we'll move it forward, and then we'll take it up there and we'll have some answers. Or by then, if everybody's good with that.
I can read, it says for Leelanau County's volume, 74.92 hours in 7 weeks. The contract provides stability at mid-market rates. The contract deals with an overall number based on a year. It doesn't, it's not broken down by hour, just assuming he's gonna be here for 3 days a week. So if that's not part of the contract, what I'm reading, that's part of the report that we received. And there's just a disconnect between the report and what the contract says.
Yes.
Yes, I do.
All right, so we need to change that motion. Is that what you're going after?
Yes.
Did you want to,
Well, I didn't do the motion, so.
so did you want to change that motion when to just forward it on to next week?
I think you still want the motion to stay the same, because that's all that all the motion does is recommend that it be approved. That'll be the motion that'll be considered and discussed at the next meeting with the additional information that you're asking for provided.
Just for clarification, you wouldn't want that on the consent part, though?
Right, yeah,
Correct.
let's have it on the.
Okay, just make a
consent,
note,
yeah.
not on consent.
Yeah.
Okay, thank you.
Any other discussion? Not, all in favor of that motion, say aye. All opposed, say nay.
Nay.
Carried 6-1. All right, so nothing, doesn't.
Now you know it.
Make it certain.
Head in your back.
And we do want to hear
All right,
something to deal with these questions.
yep, and our administrator will provide us that. Kathy did so. All right, next up, we have item number B, boards and commissions, Veterans Affairs. Mr. Wessel.
We have three good candidates, but I move to recommend the appointment of Justina Abaca as Leelanau County's representative to the Veterans Affairs Administration Committee to serve a partial term expiring December 31, 2026.
Support.
Supported, discussion? Not, all in favor of that motion, say aye.
Aye.
All opposed, say nay. Carried 7-0.
Might I add that maybe it'd be an appropriate time to make a motion of appreciation to Steve Stanton for his many years of service on the Veterans Affairs Administrative Committee, as well as gratitude for his military service to his country while serving in Vietnam during the Vietnam War. Can I have a second? Sure.
I don't think we need any discussion on that. All in favor of that motion, say aye.
Aye.
All opposed, say nay. Motion carried 7-0. Thank you, Al.
Question. Can I have that piece of paper?
Just so she has that line.
Yeah,
Okay,
you can just copy it.
okay, thank you.
All right, next up, we're item number C, under administration, resolution to approve the Purdue Sackler small manufacturer opioid settlements.
Yes, Mr. Chair, these are the two settlements that we need to approve. And there's also a third settlement participation agreement that we need to also approve. We already, that settlement did not require your approval to enter into it, but you do have to essentially elect to participate or not. And our attorneys are recommending that we do elect to participate. As I indicated in the EDS, I would ask that you consider all of these together since they kind of do integrate with each other. But there is a proposed motion to proceed, so.
Walter.
I move to recommend the Leelanau County Board of Commissioners approve the attached resolution to approve the Purdue Sackler small manufacturer opioid settlements and Sanda settlement participation agreement.
Support.
All right, moved and supported, discussion? Not, all in favor of that motion, say aye.
Aye.
All opposed, say nay. Carried 7-0. Next up, we're to item number D, fall 2025 2% allocation agenda supply.
Yes, thank you, Mr. Chair. These are just indications that from those departments and entities that wish to seek application 2% funds for the fall 2025 cycle. They've all been provided to you. The information has been provided to you individually. And if there's anyone that you want to consider separately, you can have that obviously considered as a separate motion.
I move to recommend that the Planning Department, Senior Services, Human Resources, Sheriff's Office, Housing North, and Share Care be approved to apply for 2% allocations for the fall 2025 cycle.
Or discussion, Mr. Money?
Yeah, I would ask that the senior services and housing north be looked at separately.
All right, so the motion that's just for planning department, human resources, and the sheriff's office, and share care. Need an amendment to that, or?
Your rules require or indicate that that the severance of a question can be requested by any individual board member. So there's no motion or any debate. It's just the four others would be considered as a single motion. The two and the senior services, Leelanau Christian Neighbors.
Yeah, it just removes those two from
Right.
her.
That was just my.
And the housing north would be separately done by separate motion.
All right, everybody understanding of that? Any discussion on that? If not, all in favor of the original motion, say aye.
Aye.
All opposed, say nay. Motion carried 7-0. Okay, now we got the.
And senior services would be the first.
Senior services, Leelanau Christian Neighbors, who grant their application considered separately. We need a motion and a second for that.
Make the motion. Last one.
I move to approve the senior services Grand Traverse Band 2% allocation application as presented.
Support.
Supported, discussion? Money?
Yeah, I believe that this seems to be a regular thing that senior services ask for. So I would say that the amount that they're asking for just should come from their budget. They continue every year. They have a budget of well over $1 million. And rather than having this money go to a person who has the money, it can go to a government agency that needs it. So, I mean, I just think that this is not something that it happens it seems like every meeting. I haven't seen what the 58,000 they got last time went to. So this could be put into their budget as a regular item. And we wouldn't have to take it from other entities of government.
It sure would seem senior services is limited in age and income qualifications. This money goes to the Leelanau County Food Pantry for everyone in the county.
Then that's a violation of the rules.
No,
Yes, because it has to go with people 60 and
if
over.
it's done through senior services, they're just passing it through.
Yeah, no surprise it came up and no surprise my response, but I just reviewed the 2025 United Way Alice data for Leelanau County. 38% of our families are in the Alice category, and 9% of our families are in the poverty category. Almost 45% of our families are restricted by resources in our community. We need to step up and support our community partners. I understand that Mr. Bunnick would like to have that channel from, but he would also protest if senior services to write a check to the food pantry, because we can't do that. but we can work with our collaborative partners and provide support services that support our goals and our functions. And we have a county filled with needy people. We have an opportunity to serve those people. And I don't know why we have to, every single time this comes up, have the same debate. It's legal, it's good for kids, it's good for people, and the tribe is a partner with us, and they support it because they value us.
All right, any other discussion? Anybody?
Yeah, it has to go to people 60 or over. Senior services, that is their criteria. It cannot go to people in general. And so if that's what you're saying this is going to do, we're actually violating the policy of senior services. Because this fund is funneled through senior services. It is tax dollars and it needs to follow the rules of senior services. It cannot go into people in general. And that's what I know is happening. And so we continue to violate our own rules and actually what was the funds that were set up for senior services. So I would have to say that we're not only violating our own rules, we're also taking tax dollars and away from other government agencies, whether it's schools, fire departments, villages, and townships, and we're actually giving these tax dollars to in an illegal manner. So I do believe that we cannot, if what Commissioner Wessel is saying, he's completely wrong in how we're giving this money out. And we should find out what we're doing, if it's going to people over 60 or not, because it has to, if it's through senior services.
Discussion? Another?
I think we need a legal opinion on that, but we have, because we hear this every time this is approved. First, I believe the prosecutor's office said, I'll use it, I'll pass it through. Then, and that happened for a few years. And then who passed it through next? We tried the township, we tried the school. It's just a pass through. It's not our money. It's very generous of the tribe to help us with this. So let's make sure we're doing it legally, but we need to make sure that we're not a roadblock.
Right, one more comment and then I'll move on.
We don't need a legal opinion on it because we have one. We have already been informed by our council that this is appropriate, as long as we're supporting a function that relates to one of our services. Not necessarily mandated services, but one of the services that we provide. And this does, and that's been verified by previous legal opinion.
All right, all in favor of the motion?
No, let me just, I've never voted against one of these, but I gotta say that I wish this went through some other department rather than our senior services. It just doesn't make sense that that the LCN's food pantry goes to everyone. And I know how much, that a lot of this is for families with young kids, which you wanna help, but it just seems like we'd have a better funnel than the senior citizens department.
We could do it as a board of commissioners. We are also a department.
I'd feel much more comfortable doing that than putting that through senior citizens. Yeah, I appreciate your opinion on this, Jeff.
It may not have been as clearly explained at page 195, but I think the argument that's being made is that the amount that is going to be sought through this 2% grant would fund an amount equivalent to the amount that the food pantry has for customers that are senior citizens. That's it's 20% of the,
right.
It's 20% of the total budget. And again, there could have been some additional data to support that, but the notion is that's 20% of the food pantry budget, and it represents 20% of their customers that are seniors. That's the idea. If you'd like to get a little bit more of a data that demonstrates that, you can do so. Alternatively, as suggested, it could be another department of the county that supports it, but I don't think, I think that was the intent of why senior services is the entity that functions as the pass-through entity.
So if that's true, then senior services could write the check out of their own thing to Leelanau Christian Neighbors.
No.
Why not?
They could not, because we cannot fund, government cannot fund directly a nonprofit. You just can't do that.
But
That's
these are their property taxes. So we're
No.
saying their property tax, no, it's payment in lieu of taxes, property taxes.
It's not, we've had this
That's right in the
discussion.
contract.
It is not, I don't want to,
But Tim, we can contract with them.
we can contract with a nonprofit. That's what our legal, that's what the legal opinion that we had from the past says that. That is exactly what the consent judgment from that defines the 2% process, as well as the tribes process indicates is appropriate. Is when there is a contract with a governmental entity that this can, acting as the pass-through entity, they can fund, the tribe can fund nonprofits in that manner using the governmental pass-through. They're committed to do that. And to challenge that
You're
process.
contradicting yourself there. You're contradicting yourself because you're saying that senior services can't send it to them, but if they have a contract, they could. But
No.
you're saying if it comes through the 2%, then they don't have to have a
I'm saying
contract?
what I'm not contradicting myself. What I'm saying is senior services cannot, with its millage funding, support a nonprofit. It can support a nonprofit from outside sources, like the tribal 2% funding. It can do that.
Should we call the question?
All right, yep. All in favor of that motion, say aye.
Aye.
All opposed, say nay.
Nay.
Motion carried 6-1. Right. We don't have the housing north, but somebody wants to make a motion, not. Move on.
I would, yes, we do. I would move that, or I would recommend that Leelanau County Board of Commissioners approve the 2% grant allocation pass through to the tribe for housing north.
Supported discussion. Mike?
Yeah, I would just say again, if we're going to try to give tax dollars to these people, then it should come through this regular board, through our regular general fund. It shouldn't come through this, because when we do this, we can be taking it from schools, we can take it from local townships, fire departments, libraries. And if we want to believe in this, then it should come from this board here, not from the 2% funds, which funds many other government agencies.
Discussion? Not, all in favor of that motion, say aye.
Aye.
All opposed, say nay.
Hey,
Motion carried 5-2.
Where's my second? Okay,
You're welcome.
Thank you.
All right, next up, we have 4E, authorized request for proposals for auditing services. In your handout, I believe.
Yes. We needed a couple edits to the EDS report that was provided to you, was noted on the agenda as item 4E. Essentially, we're recommending that you pursue at least a 2-year, if not potentially a 3-year contract with an audit firm. I would expect the incumbent Raymond to be an applicant considered. One of the other at suggestions of a couple board members, I've included an optional engagement scope of work would suggest the evaluation of our budgeting and budgeting process, our forecasting methods for revenues, our fund balance policies, and matters of that sort, to have the audit firm actually present a best practices proposal to the county, separate from the audit, would be considered as part of that RFP bid. We have a RFP that was done in 2024 that could be quickly and easily modified to get it out no later than the day after your full board meeting. We would like to get this considered as soon as possible, because we're running out of time to actually engage someone to perform this work. Last year, I think you withdrew the proposal as you just decided to pursue an additional year with Raymond. They agreed to do so under their existing contract. Have a motion?
Yeah, I move to recommend that the Leelanau County Board of Commissioners authorize the preparation and release of an RFP for auditing services as discussed, commencing with the 2025 audit, and for a period of at least 2 years, not to exceed 3 years, with the final version of the RFP to be approved at the September 16th, 2025 regular session.
Board discussion?
I'd like to, it's a very similar subject, but as long as we're going in this direction, I would also like to see bids for legal representation also. And not today, not tomorrow, but at some time. I know we've got the same firm, and most counties have the same firm, but I also know we went through the process as a county 10, 15 years ago, ended up exactly where we were, sort of. But I think, I think we did have reworks within the contract, and actually, I think it helped strengthen that relationship. But it also provided local firms with an opportunity, to do business with the county. So if you guys would, maybe we could put that on, not this meeting, but the next meeting, if there's an appetite for that. Separate subject, but probably somewhat related with professional firms.
Is that contract even up? Close?
I haven't looked at it. I think it is. I could get information for you.
I think it just gets renewed every
Right, but I
year.
don't think it's up to,
Well,
we're in a contract.
we can find that out, and if you know. If we have to-
If there's
Yeah,
an
or
appetite.
horse.
Yeah,
I think there's real value in having a representative that works with 95% of the counties in the state of Michigan. And that's worth some capital.
I agree.
Get back to this motion.
Yep, that was a request. Usually I try to bring those up under commissioner comments, but since we're under that, I
Well,
get where
we're
you're coming
RFP,
from,
so.
All right,
Swayed in.
any other discussion under the original motion? Not, all in favor of that motion, say aye.
Aye.
Opposed, say nay. Good, 7-0. All right, next up, we are up to Board of Commissioners 5A, hiring freeze. It's an agenda item that was requested by Commissioner Robbins.
Well, about 10 minutes ago, I was thinking about pulling this when Commissioner Bunning said that maybe we could clean our toilets, but we'll move forward. Anyway, I move to recommend that the Leelanau County Board of Commissioners adopt by appropriate resolution a temporary hiring freeze until such a time as the 2026 budget has been approved. The Board of Commissioners will not approve new positions. No positions authorized in the 25 budget but currently vacant may be filled unless appropriate elected officials or department heads and the county administrator agrees in a written report. Positions essential to continue existing levels of service.
Support. Board discussion. Robbins?
When I first started this, we sat here the last 3 weeks on budget, and a lot of discrepancies going on between revenue and what the budget is. And a couple meetings ago, I guess what triggered this is when Commissioner Campbell said that maybe we should have hiring freeze. So it's got thinking, and it's like, maybe that's the way we should go. But I really don't like the wording here. It's a little harsh, I think, hiring freeze. It's more a strategic pause. Right now, we're still going back and forth, not knowing revenue. We heard today that the state, we don't know where they're at here in 2 weeks, if they're gonna have a budget. We don't know what the feds are gonna do. And so I think until we sort it out, we're actually starting a different budget process than what we're used to. And I feel that should just put things on pause right now. If there is emergency, we can go through our administrator, the department heads elected, and we can have discussion on that. But it's only for less than 90 days. I mean, we'll get this done here probably by 1st of December, but until then, let's just sit back and see what funds we have. We're going to have departments coming in. They're going to explain to us some of the positions that they're asking for, and we'll see if it's good for the taxpayer, if it's good for the county, and in some of the departments I've looked at, I mean, when you look at the dashboard here that was just given, and we need to really look seriously department to department when we're doing budget this year. And there may be some departments that probably overstaffed, some could be under, but I think for the time being, until we know what direction we're going, I think it's safe, it's good business, smart business, that we just put this on pause until the budget's complete.
Yeah, I support this motion because I've, for a long time, been uncomfortable with, when vacancies occur, we ought to see if there's an opportunity to take advantage of that position and serve our needs better. We always just roll over positions. We've got new software coming. We've got new needs. We've got new technology. When we have a vacancy, it seems to me we ought to say, is that the best use of funds? I did look at this dashboard too, and I look across all of our departments. And I know this is just rough and different counties do it differently, but in most of our departments, we're almost at the top of expenditures per resident. And I think we ought to look at that. And I think not only should we have a hiring freeze, but we ought to have a long-term plan for meeting the needs of the future. And it may mean some decreases in some departments and some increases in some other departments. We've also added 10 hours a week to each staff person working in these buildings. And we don't, I mean, 10 hours a month. Yes. 10 hours a month. So 20 hours. The number of staff, that's a lot of hours. That's a lot of hours. So I just think it's an opportunity to be cautious. It's an opportunity to be responsible, and I support it.
Any other discussion?
Yeah, it really does make sense on the face, but I'm wondering, there's the hypothetical, and then there's, well, how does it work in the real world? What positions do we have open that this would affect, that we're in the process of hiring, that our budget that aren't filled?
There's my knowledge, there are 2 open positions. There's a position in the finance department and then the sheriff's deputy position that are currently open.
So the finance position is, it was in the budget, and I assume our finance director assumes that she's going to be fully staffed. I just know we had this discussion in, I think, May, and we were, paying the affordable subsidies. Now we're not. And I just want to make sure as we get into this budget season that our finance department is ready to rock and roll as we're ready to rock and roll.
Yeah. Right, this Commissioner Bunnick's hands enough to move on.
Yeah, that's my concern too. We have positions that we've already allocated, And I know the sheriff has people in school that are coming out and that he's planning on hiring. I know that the finance director is looking at person to hire, and I think I like the idea of looking at each one, but I don't think we have to stop what's already been set up. So I don't think we need to get into the hiring freeze. We're really looking at our budget, and I think that's the time to really look at these things, but not to stop people from doing the work they need to do or hiring the people they need to hire. And if we're gonna look at a different audit company, I think we really want the finance director to be fully staffed and go through that. So I would not support a hiring freeze at this time.
All right, Commissioner Albert?
I'd like to hear from the finance director what position she still has to fill. I thought you were done.
Nothing?
The approved staffing level for the finance department is 2 clerks, account clerks, and 2 executive positions, assistant finance director and the finance director. Those are funded, they're approved staffing levels. They are budgeted for 2025. They are in the proposed 2026 as approved staffing level, and the impact is reflected for the Teamsters in your 26 budget. So that's already reflected. These are Teamster positions. And typically the staffing in the office, one clerk is predominantly AP, and the other clerk is payroll and grant reporting, grant reconciliation, billing, things like that. So I've been training Mike Berkmeyer, my assistant, in payroll because I want him to train the next payroll clerk. I tried to train the previous payroll clerk, but that took me out of my role in an executive position to assist you. So I would like to restore my department to where Mike is overseeing the day-to-day, and it can put me back into my executive position to more, to be able to report and work for you better. And so this position is open. I also have a plan, and it is underway, to cross-train both clerks so that if we have a leave of absence for any reason, the one clerk can cover for a short period of time and have a knowledge of that desk. So my clerk Elizabeth has indicated she would like to expand her knowledge of the department and be laterally moved into the payroll position. And my hire would be as AP.
So you only have one account clerk.
I have 2 approved. I only have 1 in staff right now.
It sure seems like that's.
But the motion that's on the table says that the department head or the elected official could meet with the administrator. And if they both agreed that that was a priority, then they could fill it. That's only responsible administration. I believe that we hired an administrator to help us. And Kathy should meet with Jim, and if they agree this is critical, then that motion allows it to be filled. But what I think the motion says, we're not going to just fill it without that kind of interaction.
Mr. Rollins?
As far as the ones in the sheriff department, they're technically hired. They're not, they're in academy and they have a job, so they're not getting cut.
Discussion?
I appreciate the discussion. I was talking about in the future budget when I brought it up, but I think it is a valid discussion for the current budget too. I may not vote for it, but I appreciate you putting it on the agenda and having the discussion. I think that's important.
Any other discussion?
Just one. It's not unusual during the budget process to pause hiring, particularly if there's a possibility that you're going to consider changing positions in the future. So this is something that you might even want to consider having part of the budget, your budget rules in the future. But I understand all the arguments pro and con, and I agree that the motion does give some flexibility where there's a specific need demonstrated.
All right. All in favor of that motion, say aye.
Aye.
All opposed, say nay.
Nay.
Want a roll call?
Carried.
With the understanding that you'll approve.
Go ahead.
Commissioner Robbins,
Yes.
Commissioner Walter,
Yes.
Commissioner Wessel,
Yes.
Chairman Yoder,
Yes.
Commissioner Elguyer,
Yes.
Commissioner Bunnick,
No.
Commissioner Campbell.
No.
5-2.
5-2.
Now I have that this is a resolution, is that correct? It says, yeah, your motion is by appropriate resolution. In your motion. Okay, so I just wanted to make sure someone's producing a resolution for Tuesday night,
Okay.
correct?
Yes.
Okay, I just want to make sure that wasn't mentioned. Thank you.
All right, next up is 5B, release of attorney opinion regarding conflict of interest policy. It was brought to the board by Commissioner Campbell.
Everyone's got the information on it. There's nothing secret about this particular opinion. And I just think that people pay for the attorney and the attorney's opinion, and they should have access to the information and opinions that they're paying for.
All right, need a motion?
All right, I'll do it. I move to recommend the Leelanau County Board of Commissioners waive its attorney-client privilege and release the July 25th, 25 legal opinion concerning conflict of interest.
Is there support? Supported. Discussion? Not all in favor of that motion, say aye.
Aye.
All opposed, say nay. Motion carried 7-0. Next item C, conflict of interest policy expansion, discussion only, brought to us by Commissioner Campbell.
I did this in relationship to that opinion, and I have a belief that there needs to be some separation. When you sit on a board or a commission, or you represent Leelanau County, there needs to be separation between who you represent, which is Leelanau County, and the entity before you, whether it's an individual, a for-profit corporation, or a nonprofit corporation. And what we have currently addresses mostly a financial interest. And I just think it should go beyond that. As in, if you have multiple nonprofit boards bidding on a particular item that we may have when we do business with nonprofit boards, that if you have to sit on with that nonprofit, you have to have a very, very official, close relationship, that you should be excused from that. You should declare a conflict, and you should not participate in that discussion. I had written that, given the opinion offered by the attorneys, which relied heavily on a definition of conflict based on monetary compensation, I would like to begin a process to expand our county conflict of interest policy to include dual allegiances that are common in community. The attorney's opinion determined that a member of the county land bank authority did not have a conflict of interest of motioning for and voting to approve a contract with a nonprofit corporate entity on which he served as a corporate board member. I feel a conflict of interest exists when members of the county board, commissions, committees, whatever, as well as administrators and department heads, hold positions of authority with entities that do business with Leelanau County. Such conflicts should be declared, and the person with the conflict should be excluded from related discussions and decisions. So that's how this got here. And I don't think it would actually take too much to add that into our conflict of interest policy and do what Mr. Dyer sought in what he wrote to us, which is all work on under the same terms, have one conflict of interest policy that governs all of our bodies ourselves and county government. That's my thought.
Right.
And I did propose a motion that essentially directs me to collect whatever policy we do have now and send them to the legal counsel to consider drafting a uniform county policy that addresses your concerns. One thing that I also think you're going to need to do is to do a little bit of a survey as to those that are currently serving on county boards to determine if they might have relationships that would come into conflict and require them to either recuse themselves or resign from the boards if that were the case. So those two things, I think, are the parameters of what you would want to consider in revising any policy that would be applicable to all county boards and commissions.
All right. Need a motion to move this forward?
Again, I'm on the wrong page.
Page 210.
Mr. Money?
And I move to recommend that Leelanau County Board of Commissioners direct the county administrator to identify all existing county conflict of interest policies and present the same to legal counsel to consider the drafting of a uniform county conflict of interest policy.
Support.
All right, so moved and supported, discussion?
I would just hope that we've had one opinion from our legal counsel, and I don't know what his opinion of his opinion is. But I just want to make it clear that we're not, that we want to tighten that policy as opposed to just manipulate it.
And if you, I think I have a copy of what you were reading into the record. And I'll forward that along with the.
I should appreciate that.
Yeah, that would reflect what your concerns are.
Thank you, Administrator
I
Dyer.
tried to capture that in the EDS with where I indicated that that our current conflict policies are too focused on whether a board member has more than a minimal financial interest with other non-monetary relationships or simply acting as an employee or director and is doing business with the county might present an even greater appearance of impropriety or conflict.
You hit it.
Did I hit it?
you
Okay, that's what we'll do that.
Commissioner Algar?
I'm a little worried about your Titan. But let's just get a good policy. Let's not direct them.
I
about
think a
what
good
it should be.
policy on conflict of
No,
interest is
now you're
tight.
talking about the policy of the policy.
Well,
I'd like a good legal opinion. I just needed to say that.
Discussion? Not? All in favor of that motion, say aye.
Aye.
All opposed, say nay. All right, next up, item number 5D, resolution opposing MDHHS competitive procurement process brought to us by Commissioner Washington.
Yeah, thank you. And I would recommend reading the last week's Enterprise article, Local Families Watch Budget Talks, that deals with the Community Mental Health Agency, and it is in turmoil, and it is in crisis, and it's losing Medicaid dollars, and it's doing major layoffs, position cuts. They went from the Northern Lakes has gone from a leadership team of 11 to a leadership team of 6. They've reduced several $1 million out of their budget. We had a woman in the audience today that's concerned that her program that serves her adult, totally disabled son is in jeopardy. The article, Andy does a good job of summarizing, but the state has come forward with a recommendation to privatize many of the Medicaid services. And if you look at privatizing them, what that means is for-profit agencies will be delivering the services that community and mental health services are currently being provided by PIHPs. That's so a 15% cost maybe at the private with a 2% at the PIHP. Most of the community health associations or organizations and the state Mental Health Association are urging that the state does not proceed with that. It will restrict services to those that have insurance. We all know that some of the most needy ones are the ones that need the most support. This resolution is being circulated. Will and I saw it a couple of weeks ago. I am urging all of the counties in our region to support it. We cannot allow the state of Michigan to dismantle the community mental health services in this state, while at the same time, the federal government is doing much the same with their Medicaid decisions. So I would move to recommend the adoption of the resolution opposing the Michigan Department of Health and Human Services plan to implement a competitive procurement process for prepaid inpatient health plans.
Support.
Supported, discussion? Commissioner Algar?
I used to work in mental health. And especially for Medicaid services, the pay was not even sustainable for the person doing the service. So for a Medicaid client, I think I got $20. If a for-profit entity got into that picture, no one would be able to afford to give services. And that is, as a practitioner, that would absolutely destroy any services. There's very little money allocated. And if part of it had to go to a for-profit entity, that's a total misuse of our funds.
Discussion? Yes,
And thank you for bringing this.
Yeah, this is a huge, this will have a huge impact on many people, and frankly, the people who need it the most. I'm gonna vote no on this, and it has absolutely nothing to do with this resolution. But I've seen these resolutions devolve from embrage to abortion before. And I just, as a county board, I don't want to get into these types of resolutions on affairs that are well beyond our means to affect. So that's why I just don't, I could come up with 10 of these a meeting. And I know.
I want to react to it if I can.
Oh, please.
Because I think the board's been really responsible for the last several years, not bringing silly resolutions to the table.
I think so.
But this is a resolution that directly impacts the services that we're supposed to provide to our residents. This is a resolution that protects local control. This is our business. And for us not to take a position on what's going to happen to our 20,000 residents out there is irresponsible. This is not an irresponsible resolution. This is a message to the legislators: please don't destroy the services that our county's residents get. It's quite different.
Any other discussion? Commissioner Bunny?
Yeah, I would say that, yes, bringing Enbridge here for a resolution is silly. I would say bringing abortion here is not silly. There's a huge difference between the two.
Any other discussion? Not, all in favor of that motion, say aye.
Aye.
All opposed, say nay.
Nay.
Carried 6-1. All right, next
I was on your
up,
side.
we are to review of financials. Our finance director here. Any questions?
Claims and accounts questions? These are pretty typical invoices. I didn't see anything that was concerning.
I reviewed everything, and it was pretty much all standard, seemed like. Any questions?
The point contract for region cabinet 14 get paid?
It's still outstanding.
Because I got one property that has an issue.
Any other questions? All right, doesn't look like.
Okay, thank you.
Question?
Properties and stuff.
Next up, we have special reports by staff, commissioners, and affiliated agencies. Any special reports? All right, if not, we are on to our final public comment. You have 5 minutes to address the board. Do you have any public comment, Mr. Mikowski?
Good afternoon. The issue of legal opinions regarding conflict of interest. I recall in 1996, I believe, where Judge Rogers issued an opinion on conflict of interest, which was more restrictive than everyone was aware of in the state of Michigan. And I'm curious whether that restriction still applies or whether the legislature or has been amended. But that was more restrictive. I have a copy of it at home. I think you'll find it in the court records, and I think it included a zoning case that was involved in Elmwood Township, but I'm not sure. But I remember reading that restriction, and copies of it were circulated. So before you send it, or as you send it, perhaps it would be some research is necessary to find it and send it along with your request to our attorney to see if it's still valid or whether it's been negated. I want to compliment Mr. Walters for assisting the chairman of keeping the meeting on point. We spent 28 minutes on housing when only 10 minutes was needed for the presentation. It seems peculiar how easy it is to drift away from a presentation to a solution meeting without any direction. And we have to be careful about that because we're spending taxpayers' money. And also an item was brought up regarding Alice. Alice is a peculiar organization that has put out some data and facts which have been pretty well discredited by the Mackinac Center for Public Policy. So I want to be careful that the county does not use facts and data that may not have any credibility as it goes forward in doing some things and quoting them. The other thing on the housing is that I find it interesting to think about this housing process. Michigan is a ballot proposal state. People can request some action to be done by a local government or even the state government. I find it interesting that for most projects that people see necessary, like sewers and other things and utilities, people petition for. I have not found yet or heard of anything that the people of this county have petitioned this county with a lawful petition to demand that they spend money on housing. Maybe we should wait for that before we stampede ourselves into this process. We seem to be believing that electors and the people are not very important in this process. And we at times deem ourselves to be omniscient and omnipotent. We do not talk about the things we're going to advocate before we are elected, but after we are elected, we take on new roles and new objectives and take on new positions as we get hired. And I think we need to be careful about how we go about this, because the people have yet to petition for this county to take action on housing. Thank you.
Thank you. Any other public comment? Yes, Mr. Wiesner.
Bill Wiesner, Elmwood Township. And only way to be ensured of no fraud is one person, one ballot, one vote, one day. It was 62%. That's the number I remember. It's within a percentage or a few of points of people polled by Rasmussen of the 2020 election think there was fraud. So it's a major problem. And this handout is a great suggestion just to go along with what those 62% feel. And there's no downside to this. So how to vote? Make Elections Secure Act, the MESA, as in Mesa County, Colorado, where Tina Peters is locked up. And if you saw any of that judgment, that judge just laid into her for daring to make a backup copy, which they're required to do, instead of letting the records be deleted, which is against the law, and she's in jail right now. So this is there's no downside to this. President Trump's new executive order on election integrity is the first step to restore trust in our votes. But our Make Elections Secure Act, or MESA, honors real Tina Peters, the Mesa County, Colorado recorder, now rotting in prison for the crime of copying the Dominion election database to protect the evidence. And here's 8 suggestions that would just take away the strife. Make it so everybody believes, and rightly so, that the elections are honest. First, voter ID tied to residence, or the real ID. Secondly, citizens only voting, no foreign interference. Right now, the Chinese, different countries, they make the computers that the voting is done with. It's supposed, and they're looked at as our enemy. So we do the simple thing, get rid of the machines, and we don't have their, it's can't be manipulated. 3, paper ballots pre-printed, and I like the marks on them too, that you cannot just make a copy and have it go through, and hand marked by voter. Number printed equals number of eligible voters in the precinct plus, say, 2% spoilage. So you've got everybody's name. You don't need a whole lot of extra ballots floating around that could be used. Hand counts where ballots are cast in the precinct, where we can overlook things. Everyone can, Democrats, Republicans, no machines, no middleman. Then the chain of custody is sacred. It can't be violated that way. No little USB drives to plug in and unplug. 5, paper poll books. Check off each real ID once, self-enforcing. Nothing on computer that can be manipulated. In-person voting only, except active duty, military, overseas, and a few exceptions, but very, very few. If you're out doing your grocery shopping, you can go back to vote on one day. If you're working all that day, that would be maybe a time when you can have an excuse. Small local precincts. We have 3,000, I believe, in Elmwood Precinct 1. Cut it down to 1,500, cut it down to 1,000. If it costs some extra bucks, it's well worth it. I don't know how much work that is, but it's worth it. So we don't have all this strife. One day elections, same rules for everyone everywhere. This is common sense. This is secure. This is how we restore our trust in the elections. And people, the poll, Rasmussen polls, all Democrats, everybody, every group said they would volunteer for this situation. I would do it for free. And what I'll cover in the special meeting that we have coming up is how not to vote, and that's ranked choice voting. And I spoke with one man running for 2nd district the last time, and He didn't even want to look at my information. He was promoting ranked choice voting. Thank you for your consideration.
Any other public comment? Mr. White?
Good afternoon, commissioners. I'll keep this short and on point. First of all, I'd like to say I appreciate the time and effort you put into your jobs as commissioners. I know it's not an easy job, and making difficult decisions can be very stressful. On the other hand, you did all run for the job. So if you wonder why you're in that predicament, take a look in the mirror and ask yourself why you did it. That being said, I have two issues that I'd like to address. One involves the county treasurer, the county land bank, and the Suttons Bay School District. Specific issue involved is that our 9.5 acres of school district land that was sold to Peninsula Housing with the assistance and cooperation of the county land bank. The $800,000 transaction was facilitated by our treasurer as a service to the SBSD due to an indication that that district was in financial distress, and according to what I was told, needed $800,000 before June 30th. As near as I can determine from further discussions and questions, that impression was false. Unfortunately, based on my research and conversations with individuals involved, the transaction took place under the false impression on a number of other issues as well that should raise questions that this board should try to seek answers to, in my opinion. One, why was the county treasurer and chairman of the land bank told it was a financial emergency when it wasn't? If the treasurer was misinformed, then why was the transaction completed on a no bid basis without public comment or input? Why does Peninsula Housing have ownership rights to collect rent on that plot of land when the land bank is the only owner on the deed? Why is the land bank committed to buy back the property in 3 years if affordable housing is not in the process of being put on that land? The bottom line is that this transaction has a lot of serious questions that need to be answered behind it. And I'd like to understand why there's a tremendous lack of curiosity on the part of a number of people in this government who should be concerned. I'd also like to know why the county administrator is involved in this situation as well. That seems to be a habit of his where he gets involved in stuff that frankly are clear conflicts of interest, and he shouldn't be involved in them. It's just my opinion, and I appreciate you listening to me.
Any other public comment? All right. If not, we'll move on to commissioner comments. Commissioner comments, Campbell?
It seemed like back to the appointment of Justina, excellent choice. She was here and you could tell she really wanted that. And I wanted to make sure that that she was elected with a unanimous vote. But I'd be remiss if I didn't bring up the name. I didn't know the other fellow, but Gene Kelly, I know also applied. I know him fairly well. He had recommendations from Mike Borkovich, Jim Kiesel, Greg Mikowski, the VFW commander post, Alfred Waden, the former tribal chair. And I just think he would have made a fine member of that board also. So I appreciate all the candidates who applied. And we should, there's been discussions on the child care. And at one time, there was an attempt to set up a meeting among some commissioners and some folks from the health department. And I think it's important that we have that meeting. I had the pleasure of a conversation with Michelle, and it worked. And I gotta say that the idea of setting up a child care program, as in the county helping to pay for child care, we seem to see, I mean, we just seem to so much in agreement, and I think most folks would be so much in agreement with her and the department that we just need, sort of like with the housing, we just need to get to that next step. I don't know if that is forming an ad hoc committee. I don't know if, anyways, I just think we need to not let that fall. When the discussions that we had indicated that there would be enough funding to create an impactful program. I support the vouchers because I think that it empowers parents to make decisions. And I think it's an incentive for people with families to stay here or to move here or to make this a much easier place for them to live. So I don't know, Jim, I bring this up because I don't want to wait a month for the next step. But yeah, I'm open to ideas, Steve.
So I heard some of these rumblings and I was contemplating about amending the agenda today to set up an ad hoc committee, but I decided against that and just have the early childhood committee come in front of the whole board at a budget session and present to us as a whole. And have a discussion amongst the whole board. I talked that over with our administrator. We both felt like that was probably the better option to do, have them present. And I was actually gonna bring that up. I wanted to bring it up first, Commissioner, with them on, so.
Cut your thunder,
but,
sorry about that, I didn't know you were.
So no, I was gonna alert everybody to that,
Okay.
I'm gonna request, because we have different department heads that are gonna be presenting over the next couple of weeks at our budget session, and there'll be one of those, where we can, as a board, discuss that and figure out how to best proceed with that and come up with options and stuff. So,
What I was especially pleased with during our conversation was the thought that we can keep, rather than grow the current program for the current early childhood program, rather than grow it, keep it intact. Make sure it's running strong, but also provide increasing funds, which are, and revenue is increasing because of course our higher property tax base, dedicating those towards a child care voucher program. And this seems like a win-win all the way around. So just laying out the basics, what my conversation said, just to be as open as I can.
Gene Kelly has written 3 books. His latest one on World War II veterans was very good. I appreciate Commissioner Campbell's comments on early childhood, and I was one that favored an ad hoc committee. Because I think an ad hoc committee, first of all, I want to make it clear that we can, if we want to, have select committees. They just need to be approved by this board. But the difference between doing it at the board table and having them come in and present and having an ad hoc committee is that it's not deliberative. We have a habit of, I mean, we're going to, the same day they come in, we're going to have lots of presentations and lots of reports. So I'm not saying this is wrong. I'm just saying, let's not lose the opportunity once in a while when we have important business to do to get some different ideas at the table, cross ideas at the table, and do some real deliberation. And I think we could have done that in an ad hoc early childhood committee, and I think we've been better served than doing it at the board table. That's just.
Is that a direction we want to go? I mean, my only point is I want it to be an open meeting, even if it's an ad hoc committee. I don't want to be behind closed doors. That isn't how we should work. However, if it's I'm 1/7, you're 1/7, and
I'm willing to go with the chair's
okay
recommendation here. I'm just saying, part of we got stalled on process on this, and let's just understand that we can have select committees, but we just have to do them right.
any other commissioner comments? All right. Move on to approval of financials.
Which makes this easy for us.
It's the job of the person in that seat.
Want to switch?
You do a good job.
Yeah, I would recommend the Board of Commissioners to pay the claims and accounts for $142,867.07.
Second.
Supported, discussion? Not, all in favor of that motion, say aye.
Aye.
Opposed, say nay. Motion carried 7-0.
I would recommend that the board of commissioners pay or take care of post audit for $6,197,261.70.
Support. Supported, discussion? Not, all in favor of that motion, say aye.
Aye.
All opposed, say nay. Motion carried 7-0.
Thank you.
All right, so we got a budget meeting right after this. Is it? It's 1 o'clock or 30 minutes after, so how about we reconvene? 1:15 or so, that work?
So you just adjourned at 12:41 though, right?
Yeah, we'll adjourn now and then, well, yeah, we'll adjourn and then start a new meeting, so. All right, we're adjourned.
Good cheese.